Hey you guys, it's your girl Shay Johnson here. I am back. This is the Shay Johnson Live Takeover all day today on USA Fibroids Center's page. I told you today is all about the men, bringing awareness towards the men and just giving them a better understanding on fibroids. There's a couple people I wanted to talk to today. I talked to Dr. Shiloh, who gave great information. But now I'm standing here with my friend. Tell him who you are.
Hello. My name is Anatoly. I'm a physician liaison with USA Fibroid Centers. How's everybody doing?
This is my friend. You ready to get into it?
Absolutely.
All right, I'm going to turn this camera towards you. Dr. Anatoly.
Not doctor, physician.
Sorry,
liaison.
Physician.
Liaison.
I met you at the recent USA Fibroid Centers event that we had in Miami. We had an amazing conversation. The reason I'm saying that is because of what you do. Tell them a little bit about what you do with USA Fibroid Centers.
Absolutely. So basically my chief chore is basically to spread awareness to healthcare physicians around the area, around the county. I go to all different types of doctors, primary care, family doctors, you name it. I stop by everywhere to just spread awareness because this is really a pandemic, what's going on with the fibroids. And my goal here is to basically for everybody to be aware and for the doctors to be able to spread to their patients the knowledge that there's other treatments available besides hysterectomy and myomectomy.
Absolutely. How important do you think it is for men to be aware about fibroids?
So I'm glad that you said this. I actually have a passion in this myself, and I'm not only saving women out here, I'm also saving men too, the families. A lot of times men and women would maybe conversate about this, maybe they wouldn't. This is a very, very, very kind of sensitive topic for the woman, and it's all about families here. So with our treatment, we're not just helping out the women, we're helping out men as well to save their families.
Absolutely, because I know that fibroids affects relationships, because with me, my menstrual lasted, let me turn this around. But with me, my menstrual was lasting around 20 days. And that can really have an impact on your relationship, your marriage. And so I pulled back and I stopped dating. There's one very, very important question I would like to ask you. And we talked about this. We talked about this question at USA Fibroid Center event here in Miami. But you stated something specific happens when you go to certain clinics just to give them information on UFE, uterine fibroid embolization. Tell us a little bit about your few experiences you had here in Miami.
Yeah, here in Miami, well, let me just first off say that fibroids are a business as well, just like, selling cars or anything else. Doctors have a business that they need to take care of, and certain procedures that they do in their practice dictates the treatment for the patient. So several physicians, especially gynecologists who perform hysterectomies and myomectomies as a business, that's what they're tending on treating for their patients, and they will never recommend our services. And I have
the services of UFE.
Yes.
Why won't doctors recommend UFE as one of the options to remove fibroids, along with myomectomy and hysterectomy?
Because they personally do not perform UFEs.
Really?
Yes. The gynecologists do not perform this specific procedure because it's unique to interventional radiologists who are us at USA Fibroid Centers.
But UFE has been around since, I believe, 1985 or 95, I believe. So it's not like it's a new procedure. Why wouldn't they at least inform themselves as a doctor? I think it should be a priority that you inform yourselves on the different options so we can have an option on which to choose from, which is best for us.
I totally agree. And that is my passion, spreading awareness to these physicians, informing them that there's other procedures out there, other treatments than hysterectomies. But unfortunately, these physicians go to the hospital on a daily basis and perform hysterectomies towards their patients. So you have a patient who was diagnosed with a fibroid, they go to a gynecologist, that gynecologist schedules them for a hysterectomy without asking if, when, or would you prefer to do a hysterectomy or myomectomy? Do you know there's other procedures, there's other treatments out there? They would never mention that to the patient. And when I appear to these practices, sometimes I get kicked out.
So you're telling me, and this is a conversation, this is what I want to get into with you. Let me turn this around again. You're telling me when you present the option of a UFE to the different clinics, they kick you out for presenting the uterine fibroid embolization procedure, which will help women remove the fibroids. You will heal faster, and it's a non-surgical procedure. Why are they kicking you out?
Correct. Well, it's all business related. It's all money is the answer to that question. Like I said, my job is to spread the awareness. They're fully aware of our procedure. Just they didn't want to make their patients aware of this procedure. Otherwise, it will hurt their pocket. When a patient is hospitalized for hysterectomy, it's not just a procedure. It's a recovery process and many medications that follows it. So these medications and the actual procedures come together at a much bigger dollar sign than what we perform. Our procedure is a fraction of the price of a hospital stay for hysterectomy.
And unfortunately, that's what I went through. So instead of offering me a UFE option, which is a cheaper procedure, they offered me myomectomy or hysterectomy, because the money that they made from cutting me and removing the fibroids, they'll make more money to cut me open versus a non-surgical procedure of UFE.
Exactly.
That hurts my feelings, because so many women are unaware of UFE and they're unaware of their options. So the only options that are given to them, which is myomectomy or hysterectomy, that's all they go with. And the doctors refuse to offer UFE because they're aware of UFE.
They're aware. This is not new. It's just it's not within their specialty.
So they rather make more money by performing a myomectomy or hysterectomy. You know what? I just want to commend you for even being a man and so knowledgeable on fibroids and bringing awareness towards the options and allowing UFE to be one of the options, because a lot of women don't even understand that UFE is covered by many different insurances that we have. Not only that, it's a non-surgical procedure. Of course, it's cheaper, but most of the time your doctor won't offer this procedure to you. And as I stated before, because the option of UFE wasn't given to me, I cannot, let me turn this around one more time.
Yeah, that's the most important part right there.
I cannot have
is key, and that's most important. Each and every patient, each and every person needs to be educated that there are alternative treatments besides what your gynecologist is telling you.
I want to thank you just for coming to talk to me, because I don't know where you drove from, but he came all the way here to talk to me just to bring you guys knowledge on fibroids. And tell you a little bit about what he goes through when he's trying to just introduce UFE into our world. Although it's not a new procedure, a lot of people are unaware. So I just wanted to tell you thank you, and you gave a great male's perspective.
Thank you.
I hope you continue on with your journey.
Absolutely.
And I already told you before, I would love to be a part of your journey if you allow me to.
Thank you very much. I definitely will call you next time I have one of these issues.
Yes.
And like you promised, you'll put them on blast for me. Thank
Yes,
you so
I'll
much.
put them on blast. We'll get kicked out together.
Good.
You heard it from your girl, Shay Johnson. I will be going to the different clinics with my boy here. And if we're kicked out, that's fine. At least we tried. Thank you so much.